I have now the pleasure to invite Her Excellency, Ms. Tarja Halonen, the former President of Finland and the co-chair of the high-level task force for the ICPD, to take the floor. I believe Madam President does not need an introduction. Let me nevertheless highlight that she has been President of the Republic of Finland for 12 years, from 2000 to 2012. With a background in law and as a trained attorney, she has looked at social issues from the perspective of the law, and throughout her political career she has worked on behalf of the rights of women. Be that as a member of parliament, when she worked hard for the establishment of the Department of Equality in the Finnish government, or as Minister of Social Affairs and Health and Minister of Justice. In 1995, she became the first female Minister for Foreign Affairs for the Republic of Finland, before becoming its first female president. Internationally, President Halonen has remained a powerful voice for the rights of the poor, in Finland, in the Nordic countries, and in the world. She's an active supporter of the UN system and has served as co-chair of several UN working groups, for instance, the World Commission on the Social Dimension of Globalization, formed by the International Labour Organization, and the UN High-Level Panel on Global Sustainability. Currently, as I had indicated before, she's co-chair of the High-Level Task Force for ICPD. It is an honor for me, Madam President, to give you the floor.
Thank you. Congratulations to all of those who have... Now it works. Yeah, my congratulations to all of those who have now the special responsibilities during the conference, and also thanks for all of you for your coming here and your commitment and your work for the successful conference and also the work after that. Okay, so it has been already mentioned that in 1994, member states adopted the program of action at Cairo conference. The rights and empowerment of women and adolescents, including their reproductive rights and health, were placed at the center of population and sustainable development. Its implementation has since improved the lives of millions around the world. Let's remember that. It's a success also. Now we face an important moment at the United Nations. This planet and its inhabitants need a more sustainable future. The international community needs to accomplish a forward-looking agenda for human rights and equality for all. But luckily, we have a triple window of opportunity, as already the earlier speakers have announced. Now it is really the right time to act. So with Madam Pasilina, I try also to make all your senses active during my speech. So this triple window of opportunity. Firstly, we are taking stock of progress in the implementation of the ICPD program of action and formulating its follow-up, ICPD Beyond 2014, which we are especially here in Geneva for. Secondly, a global post-2015 development agenda is also being defined. It will need to include the unfinished business of the MDGs, including reproductive health. And then thirdly, sustainable development goals are also being developed and will, in my view, need to be combined with the post-2015 agenda. In preparation for Rio Plus 20, the High-Level Panel for Global Sustainability gave its report to UN Secretary. The panel, which has been already mentioned, I co-chaired, emphasized that the women's empowerment is the right thing to do and a smart investment. So this triple window can be beneficial economically and socially, as well as it is just for all individuals. So let's come to ICPD Program of Action. It was originally envisioned that development will be achieved when all individuals have the information and means to decide on their sexual and reproductive lives, free from violence, coercion, and discrimination. And as I mentioned, while we celebrate the successes of the past 20 years, we must take note that too many women, young people, and especially marginalized communities are being left out of these Cairo promises. So, of course, today's generation of girls and young women in our region, they are growing up with more rights and opportunities than the generation of women that preceded them, and with a greater power over their own lives. However, serious disparities among and within countries persist, particularly in the area of the sexual and reproductive health and rights. So let's take now the situation in our own area, ECE. So our area, it's a large area, rich in diversity of cultures. But the state of sexual and reproductive health and rights, it varies too widely. In some communities and countries of the region, the reality is that access to sexual and reproductive health services and commodities is limited. It's unaffordable, or it's just a poor quality. This is also the case with the comprehensive sexuality education. We need to guarantee the sexual and reproductive health and rights. And this is also the way to many good things. It's the way to lower the rate of teenage pregnancies. It is the way to lower the risks of sexually transmitted infections and HIV. And this is also the way to meet the need for the contraceptives. So why it has not yet happened? So let's notice that the barriers can be in legislation, yes, but it can be also just economical, social, or cultural. Low-income women and adolescents, and especially marginalized groups, face greater barriers to accessing these services. So even you might have a very wonderful legislation. So especially adolescents face social, cultural, and legal barriers to sexuality education, information, and related health services. If we see the statistics, what you have also there behind the doors, so in at least 9 countries, there is a legal age restriction to accessing sexual and reproductive health services without parental consent. Another example, maternal mortality is the lowest in the world on average in the ECE countries. Let's be happy for that. But then again, a closer look at the poor and the marginalized communities within countries indicate much higher levels than national average reveal. So it's not all when it's average. And then I think I'm the right person to tell that sexuality is not only for the young ones. It's a lifelong story. The ECE has the fastest aging population in the world, within the 22% aged 60 years and older today, and expected to reach 35 by 2050, so many of you. It is positive that people live longer than before. That we hope. But the fact is that we are only just learning what aging means. It's so young phenomenon in our region even. We know already that we have to guarantee decent and secure social protection and care needs, also sexual and reproductive health care for the aging population. Gender and family-friendly work environments are important. And we need policies to enable more women to join the workforce. But we need also to encourage men to take more responsibility at home. This approach, alongside improved immigration policies, can help balance the situation and vitalize the workforce. At the same time, it ensures fuller social integration. So the high-level task force for ICPD welcomes the steps that also some ECE countries have taken towards ensuring equality under the law, regardless of sexual orientation and gender identity. In 2010, the Council of Europe Committee of Ministers made a commitment to undertake measures to combat discrimination on grounds of sexual orientation and gender identity, acknowledging that many forms of intolerance and discrimination persist in the region, including criminalization, social exclusion, and violence. Dear friends, this demonstrates our political will to put an end to the violations of human rights and discrimination that these communities suffer on a daily basis. Ladies and gentlemen, the high-level task force for ICPD urges decision makers in the ECE region to prioritize the protection and fulfillment of sexual and reproductive health and rights for all. In our policy recommendation paper for the ICPD beyond 2014, we call for 4 key actions to address the ICPD so-called unfinished agenda. I take them all, and you will see them also there. So first, respecting, protecting, and fulfilling sexual and reproductive rights for all through public education campaigns, and then community mobilization on human rights, and enabling policy and legal reforms. We need to foster understanding of human sexuality as a positive aspect of life, not only no, 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 but it's a positive force. We must create cultures of tolerance, respect, and non-discrimination. We must end harmful gender stereotypes and violence against women and girls. Our governments have, of course, a primary duty to do that, but we must mobilize all sectors of society if we want to make this true. So when I say that everyone, so I'm looking at you, I mean not only some of us, for instance, here at the podium. No, when I say everyone, I mean also men, I mean boys, educators and health providers, I mean policymakers, parliamentarians and law enforcers, I mean employers, I mean private sector, I mean journalists, I mean every one of us and everyone in your own constituency. So often people are denying their sexual and reproductive rights because of the fear of the others. I suggest we all step up and decide to be brave. So, as is the theme of this conference, I encourage you to work for laws and policies that enable choices and opportunities, health and well-being. Women and girls should not be blocked by the attitudes and policies which control their sexuality and childbearing decisions. With the proper legislation, education, and information, we can decrease the need for abortion. Abortion is never an easy option. It's never an easy option. But for sometimes, it is the only option. A minimum standard must be that women and adolescent girls have timely access to quality, safe abortion services. Where women lack access to safe legal services, the poor ones risk their lives undergoing unsafe procedures, as you know. These are clearly matters of social justice and equality. So, secondly, our second key action area is accelerating universal access to quality, comprehensive, and integrated sexual and reproductive health information, education, and services. Particular attention must be paid to reaching adolescents and the most impoverished sectors of society. So I'm very happy that the young people are also represented here by themselves. And what I now demand, we can accomplish this by ensuring no group is left behind, by improving geographic distribution and availability, including in rural areas, by ensuring providers comply with human rights standards and that the services are inclusive, and of course, by making sexual and reproductive health a priority of health sector, as well as a priority of our development cooperation policies. So thirdly, we call for ensuring universal access to comprehensive sexuality education for all young people in and out of school. Young people are a majority of the population of this planet. So, and it's also in other ways, it's quite logical that the young ones have to be our priority. All young people must have comprehensive sexuality education. It is our obligation as concerned citizens, as parents, grandparents, and as policymakers. It equips our young people with the basic knowledge to make informed, responsible decisions about their sexuality and relationships. This is the way they can navigate into adulthood safely and in good health. So sexuality education does not corrupt our young people, it protects them. The task force encourages the international community to consider adopting an updated definition and understanding of good practice on what comprehensive sexuality education entails. It should not only teach about the biology and how to prevent pregnancy and HIV, but also about human rights, gender equality, the elimination of violence against women and girls, and the tolerance and respect for diversity. Such programs should be linked to the youth-friendly sexual and reproductive health services and pharmacies that respect their rights to privacy and confidentiality. So, last but not least, our fourth call to action is eliminating violence against our people, and especially what we know from statistics, women and girls. Ladies and gentlemen, all individuals subjected to violence, including sexual assault, must have access to critical emergency services for their safety and health. They also need access to justice. The Council of Europe Convention on Preventing and Combating Violence Against Women and Domestic Violence calls for the same. All countries should define at least a core package of services, including post-rape care. And this must include that in all cases of rape and incest, our policies, laws, and services ensure access to quality, compassionate, and timely safe abortion services. Even in the wealthier countries of our region, studies show how scarce and limited are the services available to people subjected to violence, especially by comparison to the magnitude of the problem. In times of the financial crisis, what seemed to be very typical in our ECE area, when violence against women tends to spike, we must preserve at least the limited services that are available. Otherwise, the costs are huge, and this is a serious issue of human rights. So, the high-level task force for ICPD urges countries to build and capitalize on what has already been accomplished through the ICPD program of action. So we have reached already a lot. We remind you to bring those commitments to the force in the new post-2015 development agenda. Sexual and reproductive health and rights and the empowerment of women and young people, it's really lie in the heart of the sustainable development. And in the matter of fact, they did especially when we all agreed to put people in focus last summer in Rio +20. Some of you were with me there, and we promised to do that. So prioritizing and acting upon these commitments is fundamental to achieving social, economics, and environmental justice for the world we want for all. So I know there is an ECOSOC meeting in the other conference room in this conference palace, and I don't propose that we are going to make a demonstration outside of the doors, but I want that you are very, very important and strong and brave group to work for these items. I think we can agree. So once again, I thank for your attention, I thank for your commitment, and I'm very confident to work with you also in the future. Thank you.
Thank you, Madam President. Thank you for your call and for your encouragement to this conference. I would like to thank you